Welcome. My name is Katie Henches, and I'm the Senior Manager of Programs at the Child Neurology Foundation. Today's talk is part of our ongoing series on emerging issues that children and families with neurologic conditions are experiencing as a result of COVID-19. These sessions bring together caregivers and healthcare professionals to have a candid conversation and provide their expert advice to the child neurology community. Today we're discussing telehealth with Holly Paauwe and Dr. Anup Patel. Welcome and thanks for joining today. Holly, why don't you get started?
Thanks, Katie. My name is Holly Paauwe. I am a parent of two, including a teenage daughter with a rare brain malformation that caused catastrophic epilepsy. She's undergone epilepsy brain surgery and requires ongoing care from a number of specialists and therapists, all of which feels especially tricky at this time, given that she continues to have seizures from time to time and lives with multiple disabilities that create complex medical and educational needs that honestly don't really care that we're living in the moment of a pandemic. Sorry, lost my place. So not surprisingly, making sure she can still receive medical care and therapeutic interventions where possible is very important to our family, like so many others in the child neurology community. I am also creator and facilitator of a web-based support group known as the Hemimegalencephaly Family Support Network, a volunteer specialty director for the Hemispherectomy Foundation, a local and state family leader, and I work professionally in the arena of pediatric resident medical education. Within each of these roles, professionally and personally, we're hearing more and more each day about telehealth. So I'm excited to join Dr. Patel in discussion with the child neurology community today.
Hi, I'm Dr. Anup Patel. I'm the Section Chief of Neurology at Nationwide Children's Hospital in Columbus, Ohio. But I also have the honor of being the president-elect of the Child Neurology Foundation.
Thank you, Dr. Patel. We're really excited to have you today. While telehealth is certainly not new in and of itself, it seems fair to say that COVID-19 has created a greatly expanded telehealth landscape for patients, families, and providers, which certainly leads to questions and warrants discussion. I can imagine as a neurologist and section chief in this time, you and your team might be navigating the world of telehealth in a new and challenging ways. Could you share how you are seeing the provider community adjust to using telehealth right now?
Yeah, I will tell you, it's been an amazing thing to watch where everybody is really scrambling and trying to create their systems on the fly. It's put a lot of stress on the healthcare system, to be honest with you, because you're trying to get this done and do it quickly. But you know, it's really amazing because it's also hopeful. I see solutions being created every day. I see resilience of those who are coming together, both from the patient perspective and the provider perspective, to try to make this work. You know, it's also trying to deal with new patients and how we can prioritize the care for the patients that we have in our practices, but also not forget those that still need us, that are new to our practices, and you know, how do we adjust for that? So it's been creating a backlog as occurred, unfortunately, for those new patient visits, because traditionally we'd see them in our offices, which is not very easy to do right now. So it's definitely been a challenge, but one that I'm hopeful for will get better and better with time.
Yeah. I agree. We're seeing that within our local health system as well. So it's exciting time, and it's interesting to think about what will come out of this. So considering that telehealth may be quite new for many patients and families in the child neurology community, can you share any thoughts or ideas for how patients and families can prepare for these telehealth visits?
Yeah, I think the biggest thing I'd say is, the first one is try not to be too anxious. I recognize it's a new endeavor and it may be something that's outside of people's comfort zones. So the first thing I would say is that, you know, if you're going to do a video telehealth visit, really work ahead of time to get logged into your patient portal that's through your healthcare system, and make sure you have all the tools downloaded prior to that visit. It'll obviously make the visit go much smoother if you've done some testing on that beforehand. The other thing is you really want to be, you want to know what your inventory is as far as your prescription medicines go, and how many refills that you still have or need, because it's really important that we're trying to address people not going without medications. And this is definitely one area where we wouldn't want to wait to the last minute or after the fact that to get your refills in. a lot of these healthcare systems are being inundated with telephone calls and these video visits, which can put a tax on, the routine calls that may come through, for example, getting refills. So any earlier advance for those refills are going to be really, really helpful. The other thing I found to be really helpful is as a parent or caregiver, write your questions out prior to the visit. And so when you're interacting with your medical provider, you'll not forget what you really wanted to cover during that visit. It's much easier when we're face-to-face to kind of have that conversation. But I found even with the video, sometimes parents and caregivers, they get a little worried, or they get, because it's a new experience, they may forget a question or two that's really important. The other thing is prioritize the questions, really think ahead of time. Okay, what are the ones I really want to get addressed? And a lot of that is these televisits can last a normal length of time that your normal clinic visit would last, but sometimes there's connectivity issues. So where, you can start the first half of the visit and then it drops off. So if that were to happen, you really want to make sure that you've gotten your major concerns addressed first. The other thing, which I know sounds a little odd, but for us in billing purposes, you got to have your child there. It's a conversation usually like we're having today, but I really need to be able to see the patient and the child. And then I will actually do a somewhat part of my examination, which, I'll use you to help me with that. And so just to be ready for that. If you have a teenager and you're not the legal guardian, or you don't have guardianship for the teen, and that she's or he is intellectually intact, they need to give permission. It actually isn't going to be from the parent. I actually have to get the teen's permission to talk to their mom or dad or caregiver. And again, I want them there. And I will, for the teenagers, we'll be engaging them directly. And so, we feel that perhaps they'll be more comfortable in this format, but, it's a little different when you're talking to your buddy, via FaceTime versus, your medical doctor on a screen, while he's in his, or she's in her, office at home or something.
Sure.
And so that's really, I think, important. Lastly, I would say patience. We're all trying to get through this together. And so I think we've had a mutual patience, both from me being patient for the, challenges that the patients have trying to log on and vice versa. You never know what you get in your home. So sometimes we've gotten my dogs coming in and other things, my daughter interrupting, and, that's an important thing to be ready for. But it's also important that I maintain privacy for my patients. And so, when I have these video telehealth visits, I'm really cognizant to make sure that there's limited or no interruptions, because this is protected time between me and you.
Right. Those are such great, I think, tips and strategies to share. And you bring up such a great point. I think it's really important for all of us, knowing that the landscape has shifted so quickly, and telehealth has just sort of ballooned for everyone, to really offer each other a lot of grace and sort of maybe even expect that there might be some issues here and there, and just relax and go with the flow. So since telehealth is new to so many, I think it's reasonable, as I just sort of alluded to expect users to have some concerns and there to be issues. What are you hearing specifically from your patients?
I think one of the ones that I'm really cognizant of is families want to know, will my insurance company pay for these visits? We, at our institution, which I know is not the norm for everybody, but at least at our institution, we're not going to charge our families if the insurance companies don't pay for the visits. So I think if you're a family member, you may want to ask that ahead of time, because not all institutions are going to be able to. We are more hopeful that insurance companies are going to be providing payment for these so that parents do not get bills. But if you do get one, just have an honest conversation with your healthcare system to say, hey, I really wasn't expecting this. Or again, if you can look into it ahead of time. I know that's a lot to ask. I think the other thing is they're asking, well, how do I do this? And every system is different. So it's really important that you reach out to your provider. The way we operationalize it here may be totally different than what other institutions are doing. One of the things we've seen, though, they ask is, what about internet and cameras? So you really need to have a good, strong internet for the video to come through. And then you obviously have to have a camera. It could be on your smartphone. I've seen a lot of people use their smartphone, so that's absolutely fine. But parents have also wondered, am I gonna really eat through my data plans? And that might be an issue. So, again, if you prioritize things and try to keep these as brief as possible, then perhaps you're not gonna have as much kind of liability from that standpoint. So those are some of the things that I really feel that they're asking about right now.
Yeah. I would say I've heard sort of similar things from the family patient parent community as well. I think really because everybody is doing things a little bit differently, the lesson here, or the thing for us to probably all take away is that we just need to have a conversation with our providers and our health system so that we're informed going in and can know reasonably what to maybe expect. So I think one of the challenges that I'm seeing, certainly personally and within the community of families that I work with, and I would expect in child neurology as a whole, is this idea of complex patients. So how are you making this telehealth world work for your most complex patients that need really consistent care?
Yeah, I think those are the ones I'm concerned about the most, because we have what we try to do is limit the need for the patient with complex medical issues to need to go to a healthcare system for anything, whether it's lab testing and EEG or other kind of routine monitoring testings that we would normally do. And so we're trying to really shift to say, okay, what's really important? Do I really need to get these labs just because I want them, or do I really think the risks of potentially exposing these patients outweigh the benefits? And so one of the things I've been really focusing on is, really going over side effects and what to look for that would be potentially indicative of like labs being abnormal. And so making sure my families know what to look for and where to find that. And then if they need to, I really want them to communicate that with me, because then I can really make a decision if we need to send them in or get them seen. We still can do in-person visits. Every institution can probably do that as well. We're just really not wanting to do that if we don't have to because of the exposure issues. One of the other things I find to be really beneficial for the complex patients is, I mentioned earlier that for new patients, it's super important to have the patient there. And for video telehealth, it's really important to have the patient there. But if you're an established patient with me, I can also do telephone only calls. Or if your video drops off, I can then shift over to just telephone and finish up that way. So there is a lot of flexibility in the systems that can allow us to help those patients. The other thing that we've done, and I think it's worked well when it can, if you have two caregivers, have the patient there for the portion that the provider needs, and then the other caregiver will take the patient and go to a different room or go to a different activity, so then I can focus on the counseling that happens. I found that with these complex patients, education has been my biggest ally, and really communicating with my families exactly what we're seeing or what we need to communicate to them about, either starting new treatments, what to look for, when to call, and then obviously looking for side effects. So those are really important things. We really want to do anything we can to minimize exposures for these kids, because they are at higher risk if they were to develop COVID-19. And so, having that team approach with your provider is really instrumental in this time and day of age. We have to have trust on both sides. I'm going to trust my families to know, okay, they're going to call me if there's significant concerns, or if I tell them to look for XYZ and they do start seeing those, then they're going to reach out and let me know. And I think that's going to be how we get through this together.
Great.
Holly, we've covered a lot of great things, but I have some questions for you, if you don't mind, because
absolutely.
I think as a perspective from a provider to hear what patients and family members like yourself, what are you hearing, or as far as from your, advocacy work, and for you personally, are the questions, fears, or uncertainties that you're hearing from families about telehealth?
Yeah, there definitely are. I think, again, because it's new to so many of our families, they have, we touched on the insurance issue. That is a big one that people are asking questions about. But I think they're also thinking about their health information and how is it protected in the virtual realm. Some of them are probably maybe using, if they're home and doing school with their kids, they're probably being exposed to Zoom and some of these other platforms. And so they're probably aware that things can be recorded. And so I think they're thinking about those things. So whatever providers can do to help families understand how their health information is protected is very helpful, goes a long way to making them feel more comfortable. And then I think the other big one is, again, because it's new, there's just a level of, say, discomfort around and maybe fear around the technology, just worried, you know, can they get it to work? How will they come across in a video setting? That can feel very unnatural, I think, to people as a general rule. They might even be worried about letting people sort of into their world, to their home world. That can feel maybe different and challenging for some families, depending upon, you know, what all maybe they have going on at home. So those are big ones, I think, for me. The things that I'm hearing most often. And then maybe to a little lesser degree, I think there's questions around too, how does care translate in that environment? Is care the same, maybe isn't the right word, but is care equivalent, or is it as good? I think we're used to being in front of physicians and having them be able to, you know, listen to our child's heartbeat and touch them and physically examine them. So I think there's concerns about what care looks like. What's the quality of that care when we shift to virtual environments?
Yeah, I think those are really great points. Thanks for bringing those up. I mean, you know, from us in the medical side, it's very important that we're aware of these, you know, fears and concerns that families have. You know, I know that you've kind of had some more experience than perhaps some others at receiving virtual care, you know, with your daughter's care. What do you think are the pros and cons of receiving virtual care?
Yeah, I think, well, certainly right now in the time of COVID-19, right, it's safer for our kids, it's safer for us. When we talk about our kids being maybe higher risk, but they may have parents and guardians and caregivers that are high risk too. So avoiding environments where both child and maybe caregiver are exposed to risks is obviously a pro. I think beyond that, I mean, certainly during this time, but any time, it's more convenient, it's more efficient. You know, you don't lose the time driving to and from. Locally, maybe that doesn't make as much of a difference to families, but it still is time and savings of time, right, for families that are already busy. So I think that's a big pro. For some, it can feel more comfortable. You're in your natural environment, you're at home, you're not in a medical setting. I think for those of us who have kids with complex needs, who've received a lot of medical care and maybe have some trauma responses based on that, it might also be more comfortable for our kids to be at home and less sort of stress inducing for them to receive care there. Another big one that I hear from people is, you know, especially for our complex kids, we may have other caregivers in the home, say nurses or home care providers that are working with our kids. They may have siblings, other caregivers, and really it provides an opportunity for those people to be involved in care as well. I think about with my son, it really provides him a window to engage and take part in the care of his sister, and that's important when I think about, you know, transition, and as Avery gets older and we're no longer able maybe to meet her care needs, really kind of helping others come along and be able to step into some of those roles. That's an advantage I see as well, and I'm hearing from other people.
What about any cons that you see, or anything that's on the negative that you can
I think we kind of touched on already. There is some limitation to examination, right? Maybe things that would need or be better kind of elucidated if you could feel them or touch them, that sort of thing. So maybe there's certain relevant tasks or routine sort of care things that you do with patients that you can't do in the virtual realm. But I think on the whole, there's far more pros to it than cons. And I think at the end of the day, for our kids, the safety piece during this time is the big one and far outweighs the cons.
Dr. Patel and Holly, thank you so much for joining us today and sharing your experience and expertise with the child neurology community. For more resources to help navigate care for children and families with neurologic conditions during COVID-19, check out CNF's COVID-19 resource Resource Center at www.childneurologyfoundation.org/COVID-19. Together we will get through this, and together we are all child neurology.